Hi.
Hello, everyone. Happy Tuesday.
Oh,
We're switching our days of the week on these things. I like never know. Like,
true.
what day of the week is that? Happy Tuesday, everyone. If you're here in Colorado, brace yourself for the blizzard that's coming, right?
Yeah. 80 degrees today, 8 degrees tomorrow.
Is that what it's supposed to be tomorrow?
No, I don't know. It just sounded good.
No, we're getting all these blizzard warnings, and I'm like, oh, okay, I'm over snow.
Yeah.
Yeah.
Yeah, that makes two of us.
Yeah. We're ready.
For sure.
All right, you guys. So what are we going to talk about today?
Do you want to talk about who we are first?
Oh, yeah. Hi, Dr. Ashley DeVore, Rise Chiropractic. That's right. Not like it's not on my page or anything, but I should introduce myself, right?
And Dr. Christina Holland from Inclusive Care. And today we are talking about the fourth trimester. We're very official. We got papers and stuff today.
That's because we had to remind ourselves of what they are. What, not our recommendations, what ACOG's recommendations are, right?
Yeah. So first and foremost, like, what even is ACOG? It's the American College of Obstetricians and Gynecologists, which is a really long name, which is why we call it ACOG. And they recently, like in the last year, redid their recommendations for the postpartum period.
Yeah, what we call or what you'll see a lot of people coin the fourth trimester, right?
I think that started with this committee opinion.
Yeah, sure. Yeah. I have no clue. I've called it the fourth trimester for a really long time, but I didn't really research for that.
Yeah.
But I mean, it makes so much sense, right? That we go through all this different trimesters of pregnancy, right? And then you have this postpartum period that is really still all about like regulating body, getting into a routine, loving on your baby, whatever it is. But it really is this other period of time of where our bodies are changing and we're growing and everything, right? So it's really a good name, right? The fourth trimester. So you don't forget that, it's not just as much as you want it to be sometimes, or other people want it to be, it's not just going back to normal.
Yeah. Right. You're not just pregnant and then not pregnant and now you're done.
What? So. Life is like the same, right? Yeah. Nothing changes.
No,
pregnancy.
Not.
Yeah. So on their website, they have their committee opinion of the fourth trimester, which is the document we're looking at. We can definitely.
Yeah,
gosh, actually, I don't think I totally linked the other article from last time. I'll need to do that on the last video. But
fix that.
Yeah, and we can link it if you want to read it. It does. I mean, it does a good job of outlining everything that they recommend and maybe what they're changing or whatnot. What are some of the highlights that you kind of picked out from their recommendation of care? Postpartumly.
Yeah, so they actually talk about how newly postpartum women are they mentioned by name dyspareunia, which is the medical term for pain with sex.
Yeah.
So I thought that was really good. And they also directly talk about incontinence. And so even in these guidelines, they recommend referring out to physical therapy as necessary, which I think is low-key hilarious because that's not always what I see.
Oh, yeah, you're right. Well, and with all of this, right, like we were kind of talking before that these are recommendations that their own
governing body
recommend, but it by no means does it mean we're actually seeing it put into practice.
Yeah.
Actually, I don't feel like I've seen it put into practice at all as far as in a traditional like OB, maybe even hospital midwife group. A lot of these recommendations and things are I feel like home birth midwives have been doing more than forever, right?
Yeah,
it's just part of their postpartum care. But I mean, that's good that they're saying that.
Yeah.
Right? So
it's got to start somewhere for sure.
100%. And then it's starts with us too. And then our client and patient base of, maybe asking about those, like not being afraid that if you are having any of those issues to say something or what are your recommendations for, maybe you even know the answer already, but just to make them aware of that, right?
Yeah. I think that's part of why I wanted to talk about it today was if you don't know that this should be part of your postpartum assessment, then you don't know to ask about it when your doctor maybe or maybe doesn't cover it.
Right.
Yeah. And so first and foremost, this is recommending that you get seen it within 3 weeks of delivery, as opposed to just a 6-week checkup, one and done.
Yeah.
So the whole point of this is really that the postpartum period is much longer than we really give it credit for. And we just aren't doing a good job. It shouldn't just be, okay, come in for your 6-week visit and now you're gone for forever. You're now postpartum. Congratulations. Here's your baby.
Right. You come back in a year for a PAP and a checkup. Right. Yeah. Yes. So with that being said, for sure, as much as you plan for delivery and birth and everything prenatally, you should definitely have a postpartum plan. BirthFit has a really good one. I'll try to also remember that, mind check, to link it. But it's just to think about, like, who do you want around in your postpartum, right? Like, what friends, what family, what are their jobs? Yeah, that works. Jobs in the postpartum, you know, like, do you want somebody to come over and just hold and love on baby to give you a chance to shower? Do you need them to come over and help you cook or clean or whatnot, right? So it's like having that laid out. So who's going to be a part of your postpartum family, right, or group? Who's going to be part of your postpartum as far as care practitioners? Like, even though you may not think you need a pelvic floor PT, a chiropractor or whatnot, I mean, it's good to have good recommendations and in case you are having pain and discomfort, though we want you to come even if you're not, you know, but at least if you start to have it, you have that list, you have an IBCLC, somebody that can help you with lactation, you have all kinds of team members, right? So who are your care plan, your practitioners in your postpartum, and then what are you going to do postpartumly, right? Like, are you going to kind of have a lie-in period where you're going to just hang out around the house and maybe take little small trips and whatnot? But it is good to plan for that postpartum. And they do good. They kind of, their postpartum care that they outline in here is for when you come into their office. So, I mean, when you look at it, though, it is still good to maybe give you an idea of, like, what you should be thinking about postpartumly, too, and maybe questions to ask, right?
Yeah, so just like a quick list, something that we're really concerned about in the postpartum period is, like, mood and emotional well-being, because you're going through this huge transition, and your hormones are all over the place. So,
and you're not sleeping.
Yeah, right.
And baby might not be the most pleasant, beautiful baby you thought it was going to be.
Yeah.
I mean, that happens. And it happens a lot, you know?
So then the next one is, like, infant care and feeding, which is a whole nother thing is, are they able to latch like you want? Are you able to feed the way that you thought you were going to be able to feed? So talking about that, is it painful? I know you and I both see people who are breastfeeding and having, like, back pain, for example.
Or pain in your boobs. Like, you know, they always are like, oh, breastfeed, like, there's going to be pain. I say, okay, there might be a little discomfort early on because you're not used to something latching and, you know, like nursing from your boob 24/7, you know, but if it's anything more than, like, a slight discomfort, like, that's not normal. You know, so I don't know how many OBs necessarily are maybe having you sit there and watch you nurse. I feel like there's probably not that many, but it is definitely something that you want to have evaluated, even if you think everything's fine. Either, you know, have anybody that's trained in it, you know, so you could have an IBCLC. You can go to some of these really great meetups around the Denver area that are free or donation based to just, you know, just watch and make sure that things look okay. Right. And so baby should be able to latch and be able to nurse pretty well, and you shouldn't notice any, like, they favor a boob or anything like that, but also you should not have any pain with nursing, right? So they do recommend that, and I mean, I'm assuming that they're probably talking about it, probably asking you, so that means tell them. Right.
That is the other side of this, is, like, if you're having a provider ask you these questions, you really have to be, I understand that can be a little bit awkward and uncomfortable, and you're like, ooh, that seems really personal, but at the end of the day, like, your willingness to be upfront and honest with your provider is what's going to help you in the long run.
Oh, 100%.
And there's no shame if your baby isn't latching. There's no shame if you are having baby blues, or if you don't feel well, or you're not sleeping, or you just feel different. Like, that's to be expected, and it's okay. But you have to reach out and let someone know. Right.
Nobody's a mind reader.
Right.
Exactly. And then they talk about like sex, right? And if you want to go back on birth control and birth spacing and stuff, that should be a conversation that you're having too. And hopefully, if, like, sex feels weird or not comfortable or whatnot, that they're referring to the right practitioner, because obviously your OB's not going to be able to address all of this. It's more so of acknowledging you're having an issue and giving you good references or resources, or allowing you to question and look or ask your mommy groups, you know, for resources and stuff like that too, because they're not going to know what to do with pain. Right. And I was kind of just casually asking Dr. Christina, I go, I wonder, you know, like, I hadn't really thought about it until I kind of posed the question a little bit, but so at her 6-week visit, most mommies haven't had a traditional postpartum period. So it's like, is that the right time to go back on some sort of birth control? You know, I mean, that's really selective as to your family planning and what you want for your body, but something that I'd like to explore a little bit more, like, what does that really look like? Maybe we should let mommies have a normal postpartum period before we talk about that, you know, but there are other ways to not have a baby besides just being on birth control. That is true. Right? Yes, exactly. And then they talk about birth spacing. So obviously, like, what's your family plan? Yeah. You know, that's, again, highly individual, and no judgment if you want to get pregnant right away. Well, I pray for you, mommy. Or if you want to wait forever, you know, right? Or not have any more, you know. So that's a good conversation to be having too. So I'm glad that they brought that up. And then
the sleep and fatigue piece, no one's sleeping, just talking about how to cope with it. That, you know, the idea that if your baby's crying and you need to walk away, like, it's okay, you can walk away. That's really fine. Let the baby down. Take a break. That's totally fine. Baby's gonna be fine. You need to make sure you're fine too. And then the physical recovery from birth, which is obviously what Dr. Ashley and I both kind of see a lot, in terms of if you had a C-section, have a scar, had an episiotomy, had a tear, anything like that. If you have other chronic diseases, so if you have diabetes, or any other PCOS, like anything that could impact your care in the long term, management of that.
And if you had anything in the prenatal, right? So like if you had like your glucose was off, or you had preeclampsia and all of that stuff too. And they will, I mean, it's pretty normal that they're going to check, you know, if you tore, that's healing okay. And if you had a C-section, if that scar's healing okay. Really, I feel like if you're having any other pain, you're really going to have to bring that up. Yeah. Like, I don't feel like, I mean, they'll do this. How are you? Right? How do you feel? Right? And they're not going to say like, oh, I'm having really sharp pain right here. Like, what is that? Like, you're going to have to bring that up. Like, I know I had no clue postpartumly that your uterus going back from this to this can hurt. Yeah. You know, and can hurt like, all right, I'm good. You know, like a stabbing pain, you know, so that's something that you might have to bring up or ask about too. You know, I don't think they're going to be more checking, like if you did have some sort of stitching or something like that, or some sort of complication from that. Yeah, for sure. Right. With that being said too, it is really imperative. And I think our OBs kind of gloss over it, or maybe don't even mention, but if you did have a C-section, or if you had any kind of tearing that needed stitching, or maybe not even stitching, you need to see a pelvic floor PT. Like, you need that scar treatment, and we should be touching, you know, we kind of a society that, you know, hands off. Yeah. Like, I ain't gonna, I mean, even this, like that's not even like down there, right? Like, you need to be like skin rolling your C-section scar. You need to be lightly stretching the perineum if it did tear and stuff like that. And sometimes you need more than just yourself, or maybe you just need guidance. Like, maybe you don't need somebody to get in there and like really kind of break up the scar tissue or whatnot. Maybe you just need guidance of how to do it yourself and safely, you know, but that is something needs to be done, because that will lead to dysfunction even if you don't have another.
Yeah. Oh no, absolutely. And I've seen people who have back pain that once we treat their C-section scar, all of a sudden, like, or pelvic pain too, never do any internal work. It's just all C-section scar stuff. And then all of a sudden they're, you know, like 90% better. Yeah. Yeah. There is a great,
another thing I was telling her before, going around on the internet, there's like it's literally just looks like fabric, but they're showing like the different layers that they have to cut through to get baby out. And when you think about how many layers they have to cut through, and that it's just not just because they cut in the front, it like fascia wraps, you know, muscles wrap and stuff like that. So it's not, you can have pain in other areas besides that, you know, and as a C-section mommy or belly birth, I do love that. I just tend to always I don't know, I go the more medical term, but belly birth is a great way to say it too. As a mommy who had one, a scar feels weird, like really weird, you know, and touching it feels weird. And depending on why you had to have a belly birth, sometimes that emotional connection can be really hard. So it is okay to seek guidance in that, you know, and it's going to be numb. It's going to feel strange. I'm 4.5 years postpartum and it still feels funny and strange, you know, and I work with it a lot, you know, so that's okay. And it's okay to be like, maybe not today, maybe tomorrow, you know, that's okay too.
Yeah, I think something that keeps coming up, right, is that no one is, you're not supposed to be an expert at this. There's so much information. There's so many different providers. Like,
yes.
There are definitely parts of birth that I'm not an expert in, but someone else is an expert
right,
in, you know?
Right. You're like, how's that baby get out? No, just kidding. I get the idea.
Yeah.
Right.
But it becomes important because it can be such a weight off people's minds to just finally go in and get seen and feel like all of your questions are addressed. So if you're OB or whomever you're seeing postpartum isn't asking all of these questions, but you have concerns about any of the things we mentioned, like find someone who you can talk to about that, who is an expert at that, so that you can get the answers you need, because it is like that peace of mind is worth its weight in gold.
Right. So I guess the big takeaways is you kind of got a little bit, you can read the committee's report or whatever they call it.
Once we finally post all
once we post it, so you can kind of see. But if you are pregnant, thinking of becoming pregnant, really sit down and kind of sit with yourself and what does your postpartum look like? If you've had kids already, maybe that might be a little bit of a guiding factor, but if you haven't, just what that looks like, what you should have in your back pocket in case it comes up. Who can you ask if you have questions and stuff like that? But the postpartum plan is just as important as your birth plan or birth wishes, and it can, just like your birth plan, it can have fluidity in it and it can change at a minute's notice, and maybe you need something different, but just to have the resources is powerful in itself, right?
Yeah, and I think if you're the partner of someone who is pregnant or going to become pregnant, I think that's super helpful too, because they obviously have a lot going on, a lot on their mind, and so it can be super helpful and for you to be supportive in this way and be thinking about these things so that they don't have to. So that's cool too. Yeah,
exactly, right? Because in the postpartum, as a mom, you will need help, and it is okay to ask for help, and it is okay, to say, can you pick me up food? Can you bring food? Or whatever it is. And that is okay. I think sometimes we think we have to be superwoman. We have to be back to work in like 3 weeks. We have to be post-baby body or pre-baby body, whatever, in like 6 weeks, so it is okay to ask for help. And by all means, to ask your partner for help. They, in some way help make that baby, or they're being a parent to that baby, even if it's not there, whatever, it's like they're there to help you, and it's okay to ask them for help. And if that relationship needs some help, it's okay for you guys to ask for help in that relationship too, right?
Absolutely.
Because a baby can really change a relationship. That is for darn sure. Yeah. All right. Well, anything else you can think of?
Nope, that's good.
Yeah. I don't know what we're going to talk about next week. So you guys have any suggestions, right? I know we had a suggestion from our pelvic floor workshop. That was awesome, by the way.
Great.
So be on the lookout for the next one so you can join us. But talking about menopause and pelvic floor. It's kind of more her realm. Menopause and pelvic floor, and menopause and pelvic floor, and never having a baby.
Yeah.
Like what are those challenges and stuff. So maybe we'll tackle that next week. Maybe that would be a great thing to tackle next week. So if you have any suggestions, obviously let us know too, right? All right. You guys have a great Tuesday. Get out and enjoy the sunshine before it's gone. All right. Bye, guys.